let's have the conversation going. And Stephanie, we all know your story, but I think that it's the enlightenment that you give all of us when you tend to relate your story to how people can survive, etc. And I think that, how do people relate to your story?
I think some people actually think it's not real because I'm just so relaxed and open about what I went through. So when I'm talking about it, I think they think I'm telling some kind of a fairy story, but it's actually really real. Happened to me from 2014. To be honest, I wasn't getting any pains at all in my breast. It was more I was tired all the time and those little things. And my aunt, who was dying of bowel cancer at the time, encouraged me to go and have my, have myself tested. But initially, I went to have a smear test, which is something we do quite regularly in the UK, especially if you have a history of cancer. And I did that, and they found some cancer cells there. So it was like, wow, okay. And then 3 weeks later, I had the mammogram, and there was the cells there too. So it was a matter of which one to treat first. So they decided to have the mastectomy first, and then I had my womb taken out. But my mastectomy was elective because there was a history of cancer in my family, which even after the BRCA test, they said it wasn't that high. You know, because my mother died at 48, my grandmother died at 48, my aunts died at 48, and I was 48 at the time. But, you know, it just seemed a little strange, but I was under 20% chance of getting cancer, and I already did in 2 places, so it was like a little, you know. So my decision to have both my breasts removed was mine alone, and that's how
and that was it.
Yeah.
Now, Maxime, the related story of Stephanie, the age, the coincidence of 48, 48, etc., brings into the issue of what the superstition is, the stigma, etc. When you come locally, do you get that associated with either your recovery or within the period when you got infected?
It's funny that you say that. What she said even from the beginning, that people don't actually believe what she's saying. Same thing happens to me because of the way I'm bubbly and going out, like partying and
living your life.
People think that, a lot of people think that I'm actually not sick.
Yeah.
But then sometimes we should take it as a blessing. Because if we're actually sick and then people think that we are not sick, then it is a blessing.
Amen.
When it comes to the age thing, I would say that sometimes, you know, my mom died at the age of 54. And she died 32 years ago.
Okay.
And at that time, cancer wasn't really, you know, very common. And I'm not too sure what she died of. What I know is that her lungs were, one part of her lungs were bent, like was dark. Then this is me, COVID time, getting back into hospital at the age of 54.
Wow.
And then they tell me that I have lung cancer.
And the coincidence.
Oh.
And I'm like, oh, and in July, when my mom also died. So I'm on the bed thinking like, am I also going to die? Because my mom died at the age of 54. And I am thinking that it was lung cancer, actually. And now they are telling me at the age of 55, like 15 years or 17 years down the line, that my breast cancer has developed into a lung cancer now. And I'm like, oh. So it's you get a little bit of that in you. I mean, it's scary. I mean, as much as we come out like bold, thinking that, you know, it's okay, it's a bit scary sometimes because it's a coincidence. It could be a coincidence, but it's a coincidence that becomes scary. It's a scary coincidence, you understand?
But I just say very quickly, I think our mindset, we deal with one day at a time. We don't actually, I don't anticipate.
Psychologically.
The positive energy does help. Hence the fact that people don't believe that we were just making jokes about our breasts, actually, because we both had double mastectomy. And what did you say?
So it means that you have a reduction in the size of the breast.
No reduction, they take everything away.
They took everything away, yeah.
Even the nipples. And I asked them, what does hers look like? And they don't. Honestly, you have to hear this. Yeah, they took two. And then she said,
she was saying, Shema, did you do a double? I said, yeah, I did a double mastectomy. And then I did a flap. And I said, you know the flap, when you do the flap, you have to go back and then go and do, I mean, the flap is when they take the fat off your tummy and then push it into your breast, So now I've done that. Now I have to go and let them again and let them mold it properly and then let them do all kinds of things and then put the nipple.
and all these are surgical procedures.
Yes.
They're very painful, even though you say it simply.
You know?
All right. And I saw that because you're sandwich, you're just swinging your gaze.
I know,
But, you know, these are great survivors.
Yeah.
Great psychological makeup.
Yeah.
At the end of the day, at the hospitals that you tend to do the treatment, etc., what's the annual rate of detection? And do they come early or not? And what are the consequences? Okay. All these three questions bugged into one.
Okay, so in Ghana, we have realized that over the years, we have more than 4,000 people being diagnosed with breast cancer every year.
Wow.
And out of that, we have about 70% of them who come in advanced cases. And 50% of this force, so averagely like 2,000 people die out of breast cancer, those who are diagnosed.
2K?
Yes.
Half?
Yes, half of them. So that's the statistics for Ghana. But what I think might have helped my two sisters might be that they had some psychological support, maybe a psychologist talking to them. So what we have incorporated at Trust Hospital is that when you're diagnosed, the oncologist is working with a psychologist. So it is part and a mandatory part of your therapy. So before you see the oncologist, you have a session with the psychologist. You see the oncologist, and after the session with the oncologist, you go back and see the psychologist as well. So you work with them hand in hand so that it helps, because we have some people who, the moment they are told that this is the diagnosis, they leave the hospital and they never come back.
Yeah.
They never come back.
Maybe Maxine and Stephanie are not churchgoers, so maybe they don't believe in Yeshua and Jesus and all that. So maybe that's what works.
Last week we actually had that conversation.
It's just a benefit of the doubt.
We actually had that conversation, and she said, I told her that I think one of the things that we also have to promote is that faith and Orthodox medicine have to marry and go hand in hand, because she has a strong faith and she believes that God has given wisdom to the doctors and we've been able to discover medication. And so even though she's praying, she believes that what they're doing for her is going to work. So I think that is something that...
And I think it's good that she's giving her perspective as somebody who is a clinical person. And you had your clinical treatment not here. Did you have maybe some consultation right here?
Oh, yeah, I have a doctor here, Werner van der Pooy.
Great.
I've been to the Swedish Center as well.
Okay.
So,
foremostly.
We actually have great doctors over here, oncologists and things over here.
Okay. So the question I wanted to ask with that is, the jurisdictions are different, the countries are different. So UK-based or European developed country-based, and here, per your experiences, what are the differences? For which, if somebody is not in that privileged position, could be having some problems.
The differences is that I think in the UK, if you're cancer patients, they actually really, literally like pamper you.
Wait, I mean, yeah. I think NHS, they probably would. I didn't go through NHS though. I mean, I did mine privately. But yeah, generally, if you're a cancer patient, they
pamper you a lot. You know, even in India, when you go to the oncology section where, you know, you go for the chemo and things like that, they actually do pamper you a lot. You know, they are like 100% attentive to you. I don't get the same in Ghana, the same care in Ghana, you understand? I think basically those are the two differences.
So it means that if you're Ghana with IMF, it's the same thing, whether you are better off as Ghana going to IMF or you are down. So that's the same thing. Malaria is malaria, cancer is cancer.
I deal with a lot of young ladies who go and have the treatments that I pay for.
What experience do they tell you?
And I think some of them, they say that the doctors are very dismissive. Maybe because they just have too many people waiting and hoping to have treatments. But they're very dismissive. So sometimes when they're going, I'll say, listen, when you get there, let me talk to them. And I don't have to do that to help them, you know, so the nurse is a bit dismissive. And as soon as I speak to them, they're very nice and they're running around after. And it's just not nice. Some of them are also very good. Dr. Raja as well. I mean, she's a GP, I think. She's amazing. So sometimes I'd refer her and them to her, and she'll guide them a little bit. But yeah, I do want them to be a bit nicer. The nurses should learn people's skills, because when you're going through cancer, the feeling, you need that positive energy. Without it, it hinders your recovery.
And I'm not too sure whether it's the patients that refuse to understand or listen to what the doctors and nurses are saying. Because most patients that I also talk to, when you ask them questions that, okay, so what are they saying?
They don't know.
They don't know. They don't know anything. They don't, I mean, I choose not to stick the name of the medications that I'm using in my head, right? But at least I know what I'm taking. I mean, if I need to refer, I can refer and know that, okay, this and this is what I'm taking. With them, they don't know anything. They just go and sit there. You are doing chemo. Why are they saying that you should do chemo? What stage are you? Where have you gotten to? What did they see? And they don't know anything.
But can
they
I
just
ask
know that
something?
they have cancer. That's it.
You know the system, sometimes when you go, you have to go talk to a nurse.
You're
they have to
talking
send you, in Ghana,
Okay.
they send you off to go and buy your medicine and bring it back. What's all that? I don't get it.
It's IMF treatment.
All that.
Stephanie, it's an IMF treatment. But because you are where you are, Trust Hospital, of course, is not like a normal hospital.
Yeah.
But per your experiences with your colleagues, and I'm sure you all go to medical conventions and you go for training, you share ideas, etc. In what plight does the medical system in Ghana put these breast cancer patients in? And then what treatment regimens are currently available that you tend to go through?
So I think that I get what you're saying, and sometimes maybe because of patient numbers, we deliver the information and then that's it. We don't try to break it down for the patient to understand, and I think sometimes that is why some of the patients don't come back, and that is why some of them would actually listen more to maybe a herbalist or listen more to the pastor, because they are coming down and relating to them on that level. But as doctors, treatment in Ghana has gone far. It might not be top-notch like in the developed countries, but we've gone very far. We have chemotherapy available, so surgery is available. Now we can do lumpectomy, but not like the way yours was done, where you'll be on the bed and you'll go and check and make sure the margins are free. But that option is available if the woman wants it. And then afterwards, if you do a lumpectomy and the result comes back and they see that the margins were not clear and there were some cancer cells, radiation therapy is also available, so that if some of the cells had been left behind, then we focus on that. There's also hormone therapy.
Right.
Yes. So we have all that coming on board. Yes.
All right. So my producer says we're opening the phone lines. We'll just take about 3 to 5 calls, and these questions should go to Maxine and then also Stephanie, and of course there's Dr. Swansea here as well.
Sure.
Now, Maxine, if somebody is constantly in two minds, indecisive as to, because of public opinion, community opinion, that this is the devil causing this pain, and so you have to be in a state of denial, what's your best advice in terms of why you shouldn't go for prophetic divination treatment and whilst looking at the orthodox medicine?
I actually have nothing against prophetic declarations and people praying for patients, because I have a lot of pastors, reverends, and apostles and things myself.
Amen.
Amen. I
Amen.
have a lot of them, and they all pray for me. And when I'm going to have a surgery, the first thing that I do is that I'm calling them and I'm telling them that you have to pray for me. They pray with me, and the moment they pray with me, I get this sense of relief, you understand? So I go in there knowing that I'm going and coming back. So I'm not going to tell anybody that don't get that, but I am going to tell people who their prophets tell them that nyame beye, so don't go to the hospital. Nyame beye, because my reverend and my apostles can't tell me that, because they go to hospitals themselves. So you can't come and tell me not to go to hospital, that nyame beye.
Okay. Well, I have a caller. Good morning to you. Good morning. Good morning.
Good morning.
Yeah, good morning. Please, what's your name and where are you calling from?
Yeah, my name is Hassan. I'm calling from Boston.
Okay, please, your question to any of them. I have Stephanie, I also have Maxine, and of course, Dr. Swansea here. I like to call her Yaba.
That's right.
Ronald, I think the problem with our nurses, okay, as one of the panelists said, I don't know whether it's with the numbers, but when you go to a hospital, sometimes the patients to listen to you is always a problem. You can tell a doctor that, doctor, I feel like I have malaria. And doctor asks, are you a doctor? How do you know that you have malaria? They will not even take time to say, why do you say you have malaria? Because, Roland, I am more than 30 years now. I've been having malaria. If I have malaria, I know the symptoms. But these are doctors that help, when you just say, oh, I think I have it, they will just simply dismiss you. So I think our doctors, they will need to be reoriented or repaid with that aspect. They should start patients to listen to the patient.
Okay.
For him, it is the person's body. And the person says you have he or she felt. So I think your program is very teaching this morning. And what
all right. All right, thank you very much. Dr. Swansea, how do you make sure that you are more approachable and then you better orient patients who could be in that situation?
So let me use the example he gave. And it's because there are a lot of febrile conditions that can give you symptoms similar to malaria. So I think that maybe it's the way we should go about it. But usually for me, if a patient comes and says, I think I have malaria, my follow-up question is that, oh, okay, so what symptoms do you feel that makes you think that you have malaria? And based on the answers they get, I'm like, okay, so we will do a test on malaria, but I also think that maybe we should do this to rule out that as well, because some of your symptoms look like this condition. But if you look at the health sector, generally, not from where I work alone, but generally, it's challenging. Sometimes that doctor has maybe done a night shift, but that is not an excuse, because it's the profession you have decided to embark on. So
in Ghana.
You have
It's
so
the
you
profession you decided to embark on in Ghana.
Yes.
In Ghana, we have the last caller. Good morning to you. Good morning.
Good morning.
Name, location, and then your question.
Please, is the breast cancer transferable?
Okay. Thank you. Thank you.
I think you should.
Did you transfer? Did you transfer to somebody?
So breast cancer is not transferable. So if he's asking whether you can transfer it, like as I'm sitting next to Maxine, or like a flu, it's not transferable. But what I can say is that because of genetics, so you can find it in some family members. So you can see maybe a sister and an aunt having breast cancer, but it's not because they are sitting next, like maybe they caught a cold. So
Yeah, you don't catch it through cold, not through sex, not through water, not through eating with somebody. Yeah. It is just generally genetics, right?
Yes, it's generally genetics.
All right. Now, Stephanie.
Yes, darling.
If there's a best advice to give, you've been diagnosed, you've gone through treatment, you're okay, but there could be a possibility of reoccurrence, etc. What would be the best advice for you to maintain your sanity?
I mean, I think first you have to check if you have a family history. And if there's nothing like that, and maybe just a lumpectomy or treatment will keep your breast or whatever, then that option is very real. You should just stick to it. But generally, I'm not advocating for everybody to have a double mastectomy, but for me, I just like to eliminate the risk of it ever coming back. So I had a double mastectomy. So I would recommend that you take a lot of factors into play. Don't let vanity be the reason why you keep your breast, you know, because it's only a pleasure dome and to feed children. And I remember, yes. And if, and the pleasure bit, there's lots of other places where you can get these pleasures from. So please, if you need to take your breast out, don't consider that your husband is going to be upset because they're not going to be touching them. It's fine. I make the right noises when my husband touches mine. And they're not actually very pleasant to look at. We're just saying that.
That's what was actually the question. I didn't actually finish because there was somebody coming in. What we're saying was, when I said I had a double mastectomy, right? And then I was telling her that I did a flap and all that, and I had to go in for other treatments, other surgeries. I decided not to.
Okay.
Because it was too much of a bother. So I was just telling her, if you watch my breast right now, it's like a 99-year-old 99-year-old breast that they've actually slapped on my chest. But you know what? It doesn't bother me.
No,
Do you understand what I'm trying? And I'm only saying that for people who think that, I mean, and I think for 20 years, nothing has changed in my life. You understand? Unless I'm in a room with you, you wouldn't even know. And you know what? I even walk around with my girlfriends and everything. Sometimes they tell me that,
yes,
wear your bra and things like that. I said, which one is your own? Really? I really don't care. You know,
I'm sitting here with no nipples.
I had it for 38 years. I used it for 18 good years, from 20 to 38, you know, before. In fact, I mean, I just took it off, what, 7 years ago, really. Okay. So basically, I've had it for I've used it for a good 30 years.
Okay. But if you're young, I know if you're young, that decision is a lot harder because you're thinking about your life. But again, don't let vanity be the reason why you keep them, even if you're young. If there's the right decision to make, please make it and get rid of it and have a wonderful life.
Yeah, wonderful life. All right. So if, let's say, I'm young or whatever, and then I have to remove my breasts, but I want to breastfeed, what options are available?
Okay, so if you have to take out your breast because you have breast cancer, then obviously you cannot breastfeed. So there's formula. So you can use that when you have your baby. So then you wouldn't need to keep the breast, because if you want to have your baby and take care of your baby, then you need to also live to be able to take care of that baby.
There's different ways to be attached to your baby. It doesn't have to be just about the breast alone, because some people have babies with breasts and they can't breastfeed. So it's fine. It's, you know, I just don't like people thinking about those kind of things. It's a nice thing to do.
Because
I breastfed 5 children.
If you put it against HIV, you know, HIV, you can't do mixed feeding. So you cannot breastfeed and give formula. And you have to choose either to only breastfeed or only to do formula. So what about the mother who has HIV and decides not to breastfeed, but only does formula so that she doesn't transfer HIV? It's about the same thing.
Now, Maxine, if there's a constant worry that goes through your mind, what always is it, as somebody who is surviving it, breast cancer?
I think my constant worry has been, the first time was me leaving my son, basically, because my son was only 10 years when I had it. And now I have a daughter who, now I'm not worried about my son anymore because he's grown. Now I have a daughter who's still in school and everything. So my worry more is like with them. And also, I don't want to, I think my worry also is that I actually don't want to get sick to the extent that I have to be bedridden, and those are some
that it becomes
things,
debilitating.
Yes, those are things that actually get into my mind, and I'm like, no, God, please don't let that one happen, because I've tried so hard to live a normal life, even though I have my cancer spread all over the place. You not believe if I tell you, Stephen, you know, it's in the lungs, ribs, spine, and liver now. You understand? And I actually don't feel it that much. Okay. Every now and then I get, you know, sick, but I really don't feel it on a large scale. No, I don't.
All right, Stephanie, I saw all the posters out there, so you have a.
The uncensored?
Yes.
Yes. Yes. Okay, now this is where I come into my own. All right. I'm starting a radio show here with 3FM. Called Uncensored with Stephanie Benson. We're going to be talking about everything and anything. The fact is, a lot of young people reach out to me wanting to know the deepest, darkest secrets and about relationships and sex and whatnot, because it's not all the parents you can talk to. You can't talk to your parents sometimes. And me, because I'm very open. I do have 5 children who are older as well, and they've all had sex. So I sort of talked them through it, and they told me first before they had sex, which is nice. So I want to be that person for those young ones out there. All the things that you want to know about sex, relationships, heartbreak, you know, finding the right man, knowing what the right mandingo is, all of that kind of stuff. Yeah, okay, this is morning TV. I'm going to be good. So yes, this is amazing. Today, 9 o'clock, 92.7, 3FM. Please join me, Uncensored, and let's have some fun and learn something.
Which day and what time?
Today, Thursdays,
So
every Thursday,
every
even when I'm
Thursday?
in the UK, we're doing it. If I'm in New
Is it
York,
10
we'll do
p.m.?
it. 9 p.m.
An hour down.
I know, we had to do it 9 o'clock because some church should be...
They should be sleeping.
Yeah, so for the first hour, we're just going to have fun.
Yeah.
But it's uncensored. And,
I have to join today's conversation.
Oh, come and join.
The premier
because
conversation. Uncensored.
You will learn some stuff.
92.7. And just in case you're not living in Accra, staying in Accra, starting today, every Thursday, 9 p.m., make sure your dial, if you're in Accra, is on 3FM 92.7. Or if you're outside Accra, you know TV3 Ghana, you also know the relevant pages we have for 3FM especially, 3FM 92.7. You'll find them on Facebook, Twitter, X. I'm always being corrected by Cookie and Bella. X. And then we have YouTube as well. All of them are available for you so that you constantly will have it. But
I want to say help our young people, please. Let's help our young people learn about relationships because it's so important.
Last message from you for today.
Okay, so for today, I would say that we should encourage our women to learn how to self-examine their breast. Yes, so you do that every month after your menses, immediately after your menses, so that you don't forget. If you are menopausal, then we say pick a day in the month. If it's maybe the first Friday of the month, or you were born 6th March, so you pick the 6th of every month, then you do the self-examination. Go all around like the mosquito coil, press the breast to the chest wall, and go around. Get to know your breast so that when there are any changes, you report early. And the wellness clinic at Trust Hospital is also open, so you can come in for your pap smear and your mammograms.
Are you self-examining yourself?
Yeah, I do that.
Oh, men get breast cancer too, guys. Yes.
1% of men.
Stephanie,
Do you want me to do it for you?
no. It's early morning. Why do you like this? Now, Stephanie, if your breast was nice, well-shaped, rounded, and then you have to first examine it, but the shape is like Cookie Express. How would you do that?
But when you're lying, because you have to lie flat. So when you're lying flat, they all look the same.
Okay.
I mean, the nipples might end up somewhere else, but it's okay. So you lie flat, and then that's how you check it.